Thank you very much. My name is Adrian Dix. I'm BC's Minister of Health. Today, I'm joined by Premier John Horgan to my left, our Provincial Health Officer, Dr. Bonnie Henry, to my immediate right, and Dr. Ross Brown, who is the Incident Commander of the Immunize BC Operations Centre. He's in charge of our big rollout, so it's pretty exciting and positive to have him here today, and he and his team are doing great work. We're honored to be here on the territories of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. For people joining us, especially in the news media, the presentation with respect to vaccine will take place first, and the Premier and Dr. Henry and Dr. Brown will speak to that. Before we take questions, we're going to do a truncated and abbreviated daily briefing on case counts and other issues relative to COVID-19 in BC. That will be Dr. Henry coming back and myself. So that's what you can expect. You can hear the daily numbers after we're finished with the briefing on immunization. And with that, it is my honor to introduce Premier John Horgan.
Thanks, Adrian, and it's good to be here with Dr. Henry, Dr. Brown, Minister Dix. It's just a little over 10 months ago that Minister Dix and Dr. Henry and I came to a podium in Vancouver to announce that COVID-19 had arrived in British Columbia and that our lives would forever be changed. Over that time, extraordinary things have happened, acts of kindness, acts of generosity, as well as abject tragedy in families and in facilities across British Columbia. But through the joy and the tragedy, we have found a way as British Columbians to come together, to be successful when we had to, and to celebrate when the opportunity presented itself, and to stay tight to our units, our family units, when that was the important direction that we were getting. So although COVID-19 has turned our lives upside down, today and this week we have a glimmer of hope that although the end is not in front of us, the beginning of the end may well be. The announcement that vaccines are available and will be coming to British Columbia as early as next week is a sign of optimism for all of us, an opportunity for us to celebrate briefly, but then redouble our efforts as we go into the next number of months as more vaccines become available. Dr. Brown will be talking about the logistics. Dr. Henry will be talking about the epidemiology and the value of the vaccines and how that will transform how we live our lives going forward. But before we get to that place, as in any race, when you see the finish line, you don't stop running, you focus, you dig down deep to find that extra resolve to get to the finish line. That's where we are today. The first rounds of vaccines will begin coming next week. Dr. Brown will be talking about that, as will Dr. Henry. It's a very limited supply, but a good opportunity to have a dry run here in British Columbia as we await the development and approval of further vaccines into the new year. As we see an increase in supply, we're going to see an increase in optimism and an increase in opportunities for us to get back to what is remotely resembling normal. Tomorrow, I'll be participating in a First Minister's call with the Prime Minister and other premiers across the country, and the first topic will be the vaccine arrival, how it will be distributed across the country, and what this means for the Canadian Federation going forward. Also on the agenda is a discussion of what's called the Canada Health Transfer. Now, for most people, that is just three words strung together. CHT, as it's known acronymistically by the public service. The Canada Health Transfer is perhaps the most important relationship provinces have with our federal government. And when we started our public health care system way back in the 1960s, the deal was 50% Canada, 50% province. Well, over time, that has gone to 80% province and just a little over 20% federal government. So provinces have banded together and called on the federal government to have a national conversation about rebalancing the transfer of dollars into provinces so we can continue to deliver quality health care in British Columbia and in every province across the land. As we go through the second wave of COVID-19 at this holiday season, it's going to be a difficult challenge for all of us. But if we know that in the future, in the near future, in the new year, when we say goodbye forever to 2020 and look hopefully towards 2021 and a new decade of opportunity for all British Columbians, I'm confident that the federal government, who have been spectacular with one-time funding for a range of issues since March, will also join with provinces to reestablish Canada and do some nation building for our public health care system by restoring the Canada Health transfer to something remotely resembling a partnership. Until all of that comes to pass, we have to be reminded, as Dr. Henry will remind us today, and as we all must be vigilant to keep our hands clean, to ensure that we're physically distancing, to wear masks and do our level best to not engage with people that we don't know in close proximity. That means over the holiday season, we're going to be doing things differently. And I hope all British Columbians will understand that if we make that final commitment now, with the finish line in sight, with vaccines arriving next week and in larger numbers into the new year, we will all get through this as we have to this point in time. Thanks very much for your attention. I know there'll be a lot of questions. I'll pass the microphone over to Dr. Henry.
Thank you, and thank you very much. Today is an important day for everyone in BC, because today we are talking about COVID-19 vaccines. Vaccines that are real, that are approved for use here and across our country. These are the vaccines that will save lives, will ease the immense pressure on our healthcare system, and in a few days will start to arrive here in BC. I'm very pleased to share our BC Operation Immunize COVID-19 vaccine plan with you today, and the delivery of a vaccine on this size and scale we know is no easy task. It will be the most complex and comprehensive immunization program ever delivered in BC, and we've delivered a few pretty big ones over the last number of years. That's why I'm very happy to be working with my colleague and friend, Dr. Ross Brown, along with Dr. Monica Naus and all of my colleagues at the BC CDC and the many immunization experts across our province and in our health authorities. We will be providing an overview of our approach to receive, distribute, and administer a COVID-19 vaccine and other vaccines in our province. The impact of COVID-19 has, we know, been severe. It has affected all of us. And in response, the global community of scientists have collaborated in ways we never experienced before, with a single purpose in mind: to develop a safe and effective vaccine for the world. And to speed up the process, the clinical trials that would normally happen in sequence were run simultaneously, and the greatest brains around the world were put to this process and to this task. And of course, we had an addition of a lot of money to help support the process. With this quickened time to complete the process, each vaccine manufacturer had to demonstrate clear and substantial scientific and clinical evidence to show that the vaccines they were making were safe, effective, and manufactured to the highest quality. Health Canada in our country and other regulators around the world set the bar high to ensure that any vaccines that came out of this process met those standards, that they were safe, that they worked, and that they were quality vaccines, at which point the vaccine would become available for use. The first one in this country and around the world has been the Pfizer vaccine, which is a new and exciting immunization technology, and that is what was approved here today. It is the same vaccine that was approved in the United Kingdom very recently, and for which the vaccine program started yesterday. We are still learning more about the virus. We're learning more about our immune response to it and how long that response lasts. We're learning how long immunity takes to be achieved and how long after being vaccinated we are protected. But I, along with my colleagues across this country, have full confidence in the vaccines and the processes that have taken us to this point right now. So Canada, as you're probably aware, has ordered COVID-19 or has contracts to purchase COVID-19 vaccines of 7 different manufacturers. The first of these to come to BC will be the Pfizer vaccine that we've heard about, and the second will likely be the Moderna vaccine. And that one is being reviewed by Health Canada right now, and we're hopeful that it will also receive what we call a notice of compliance or a license for use in Canada in the coming weeks. These two vaccines are developed using a new process, and they're called messenger RNA vaccines. That means that we've taken a piece of the genetic code from the virus that helps translate into the spike protein, that little spiky bit on the outside of the virus. And that protein then is produced by our cells, and our immune system responds to that to develop antibodies. And then if we're exposed to the virus, we have those antibodies that attach to it and protect us from becoming ill. That's how this vaccine works. And it's synthetic genetic material, which means that it can be manufactured in large amounts very quickly. These types of vaccines have been worked on for decades for other things like Zika and even influenza and rabies, but this is the first time that it has been manufactured and shown to work. In other words, the vaccine helps us skip the illness and get straight to producing protective antibodies. While the Pfizer vaccine that was approved for use will be available starting next week, it is not yet recommended for use for everybody. These first vaccines are not recommended and haven't been tested in children under the age of 16, so that's important, thankfully. And we know that children are less likely to have COVID or to have serious effects from COVID. They are not approved for use in people who are pregnant, and that's important because we don't yet know their safety in that population. And unfortunately, they're not yet approved for use in people with immunocompromising conditions. And that is something that we are looking at because we know that people whose immune systems are not functioning, whether that's from cancer treatments or other medications they're on, are more at risk of having severe illness from COVID-19. But unfortunately, we do not yet know if these vaccines work in people who are immune compromised and if they're safe. So these are things that we will continue to need to learn. We also know, though, that there are other vaccines being manufactured that will be coming available in the coming months. And some of those are more traditional vaccines that use what we call subunits or proteins, and we know that they can be used safely in people who are immune compromised. So we look forward to having many more tools that we can use. Both the Pfizer and the hopefully coming soon Moderna vaccines require 2 doses to be fully protected, a minimum of 21 days apart, with full immunity being about 7 days after the second dose. However, we do know from the data that was released and that the National Advisory Committee on Immunization has reviewed that you have good protection even after the first dose, after about 14 days. The efficacy or the protection from the Pfizer vaccine and from the Moderna vaccine has been reported to be in the high 90s, so 94, 95%. That means that they can protect most people from having any infection, and they've been very effective at preventing severe illness. And this is really important. This is a breakthrough in terms of the benefit that a vaccine can have. We were hoping for vaccines that were at least 50 to 60% effective. The fact that these ones are in the high 90s is the best that we could hope for in public health when we look at protecting people in our community. And I believe these may revolutionize vaccines for the future, for other respiratory illnesses, for example. And I think it's important to note that these vaccines, the trials were done in people of all ages, including older people, where we sometimes see a reduced immune response. So that is important as well, and in people of multiple different ethnic backgrounds. However, both of these first vaccines need to be transported and stored at sub-zero temperatures. That's because these messenger RNA is a very delicate substance, and it's wrapped in what's called a lipid nanoparticle. So it is a protective coating, but it needs to be frozen to transport safely. And we are in the process now of figuring out how that can be done, and we've had a trial run of the packaging that came into VC just yesterday, and Dr. Brown will talk a little bit more about that. But it needs to be handled very carefully, and it needs ultra-low temperature, so minus 70 to minus 80 freezers, which, as you can imagine, are not things that we have a lot of around. However, we have been planning for this for some time, and we do have those available here in BC, and we will be using them next week. However, we also are receiving very small doses to start with to make sure that the supply system and the whole mechanism and logistics of how it works can be done and can be done safely. We will be receiving vaccine at just 2 places in British Columbia next week. We will be receiving 2 trays at each of those places, and a tray has about 975 doses each frozen. One of those places will be in the Vancouver Coastal Health region, and one in the in the Fraser Health region. As we get our systems underway and we better understand the requirements for the supply chain, we expect to be able to transport vaccine to other locations around the province. And as we move into the coming weeks in December, we will expect to receive, and it changes daily, but we're thinking in the tens of thousands of doses in the coming 2 weeks in December, after December 14th. And then into the first week of January, we expect even more vaccine to arrive, and we have planned for expansion to at least 9 sites around the province, and we're working on having 30 sites around the province that are ready and trained to receive these vaccines. And they will have the ultra-low temperature freezers needed on site. I know many people are starting to wonder about when will I get vaccine? And as someone in public health who has an interest in immunization programs for many, many years, this is something that we are all very pleased to be able to talk about. But I do have to warn you, it's going to be a bit of a road yet. Right now, we are only receiving small amounts of vaccine. And like every place in the world, we'll get the vaccine delivered to us sequentially in coming weeks. Eventually, everybody who can and wants to get a vaccine will have access. But to be clear, this will not happen right away. We all need to continue to protect each other by taking those measures that prevent transmission of this virus. Next week, as I said, we'll be getting a small preliminary batch to figure things out, make sure we can do it safely, and we will be focusing on making sure that we can protect as many people as possible in the period of time that we have in the first few weeks and months of this campaign. The process for determining who gets these first doses of vaccine was done using the process that we have through the National Advisory Committee on Immunization, where we have identified priority populations, and these have been agreed upon across the country. And here in BC, we've taken that and looked at what does that mean for us in this province. So we have a BC Immunization Committee that has public health clinicians, pharmacists, nurses, ethicists that help us look at the data and say, who is it that's first in line? This framework will map out a systematic process for our immunization program decision-making and implementation. So we applied that situation and give it the limited amount of vaccines right now. Our priority, as I mentioned, is to save lives. And we know that the lives that are being taken and affected most right now are seniors and elders in long-term care and assisted living. In addition, we need to protect our strained healthcare system so that all of us can get the care we need when we need it. So we look at a number of risk factors as well as geographically where the virus was affecting people the most. So the first batches in December in these 2 sites will be provided to healthcare workers who work in long-term care and in those key frontline healthcare settings in our acute care hospitals. That's ICUs, emergency departments, and the COVID medical wards. As I mentioned, the Pfizer vaccine requires us to provide the vaccine at the site where it is delivered, and that will be the case for the first few weeks of this program, which means we need to bring people to the vaccine instead of the vaccine to people at this point. We are hopeful that as we get the processes and confidence in how we're transporting the vaccine, we will be able to switch to taking it to people very soon, but it may be the first weeks of January before that is possible. As well, we know that the Moderna vaccine, which hopefully will be approved for use very soon, has less stringent requirements for transport, and that it can be kept at fridge temperatures for a matter of days. That makes it much more easy to transport smaller amounts to long-term care homes for residents, for example, or to some of our more rural or remote communities. But by protecting the healthcare workers who work in long-term care and who work in those critical cares, the critical areas of our hospitals, we are able to protect the residents as well. Starting in later December and into January, we will initiate more widespread rolling delivery of the vaccines and other vaccines as they become available around the province. So by the first week of January, we expect vaccine to be available in all health authorities, likely the Pfizer vaccine, and hopefully Moderna as well. And each health authority will determine the sequencing of healthcare workers in this first population using the same way that we're doing it here on the Lower Mainland. From there, we'll add the next layer into our sequence to include people of advanced age, so people over age 80 in the community, higher risk communities like those living in congregate living situations and shelters and places where we know people have a higher risk of severe illness and ending up in hospital, and remote and isolated First Nations communities and Indigenous peoples. By late March, April, our expectation is we will have enough vaccine and likely more different vaccines to expand to include all other frontline workers, including other healthcare workers, police, fire, first responders, people who work in the important essential services like grocery stores, manufacturing, production facilities, transportation, teachers, and others in our system. We'll also be moving down our population range in age increments as vaccine becomes available. It is important to remember, though, this phasing is based on what we're anticipating to be available based on the approval of the vaccines, and as more vaccine supplies become available, that will allow us to accelerate these timeframes. And what we envision, right now we are focused on saving lives, protecting those people most at risk, and we have enough vaccine that we expect to receive between now and the end of March to cover those key populations. And that's about 300 and 380,000 people. We do expect by the end of March and going into the spring, there'll be more vaccine products and more of the vaccines available to more rapidly spread out to people in the community. And I expect that this will happen very rapidly in the spring. And that means we'll have vaccines that can be delivered through those more usual mechanisms that we have through pharmacies, through our family physician offices, through public health clinics. So that's what we have to look forward to. It is at that point when we have vaccine widely distributed in our communities where many people are protected that we will be able to stop this pandemic. That's the phase that we are looking forward to. Right now, we do not have enough vaccine to stop transmission across the province, so our focus is to protect those who are most at risk. I can say with confidence that the vaccines that we have, the one that is approved for use here today, are safe and effective and will save lives. I know many people will be eager to get their vaccine as soon as possible, and like me, have probably been waiting since this pandemic was first declared. I ask you to please be patient and understanding, and please continue to use those layers of protection that keep us all safe until it is your turn. We are not yet through this storm, but our plan has been built to be flexible, and there will be changes along the way, and we will let you know when we know. There will likely be some hiccups, and when they happen, we'll adjust our plan, and we'll respond to the circumstances at the time. And we'll continue to update people all along the way. As we approach the winter solstice coming up, the longest night of the year, there is light ahead. And that light is shining a little brighter today. And I think we can all be thankful for that. I'm now going to turn it over to Dr. Ross Brown.
Good afternoon, everyone. Thank you very much for the introductions. It has been an honor to work alongside Dr. Henry and Minister Dix. I thank you. And it is an absolute privilege to serve as the incident commander for what we are calling our Immunize BC Operations Centre. It's made up of the team of respected experts to safely and effectively deliver the COVID-19 vaccines to British Columbians. And let me begin with an overview of the logistical planning already underway, and then I'll speak to our phased approach to distributing the COVID-19 vaccines. You've heard many times, and across this country, it's already been said, but it's worth repeating. This is a complex task because of the variables and sensitivities involved in the delivery of the COVID-19 vaccines, which will be happening next week. However, when it comes to immunization programs in British Columbia, this isn't a new task for our public health teams. They have done exceptional work immunizing British Columbians against numerous viruses, including measles, seasonal influenza, and the 2009 H1N1 influenza campaign. We are fortunate that our public health experts will be vaccinating against COVID-19 on a strong backbone of an immunization system that they have developed and refined. When Premier Horgan, Minister Dix, Dr. Henry and I initially discussed the logistics involved, we acknowledged that the COVID-19 program is more complex because of the different vaccines. They'll be arriving at different times and their different characteristics. To do this effectively and safely, we would need to draw on our experts and develop a coordinated and collaborative immunization program. And that's why we created BC's COVID-19 Immunize BC Operations Centre. And the experts supporting the Operations Centre are comprised of members from BC Centre for Disease Control, the Provincial Health Services Authority, including their Health Emergency Management BC members, First Nations Health Authority, Canadian Red Cross, Canadian Armed Forces, leading scientists and ethical advisors, and health ministry leadership, including direct links to the regional health authorities in our province. The Immunize BC Operations Centre brings the experts around the table that have the knowledge and experience to be nimble and to rapidly respond to evolving scenarios. They have teams under them that have great experience in working with immunization and vaccine challenges. And the Immunize BC Operations Centre allows our key players to be coordinated and share information rapidly as the conditions evolve. And this will allow us to inform and advise Minister Dix and Dr. Henry in a timely and coherent manner using structures and functions that are designed to work in crisis situations. And using the Immunize BC Operations Centre tools and processes to bring out the best in our leadership team, and it allows us to immediately address any glitches along the way. Our primary goal is to ensure our public health system is ready to administer vaccines as they become available. And together, we're working in lockstep with our federal counterparts to receive shipments of the COVID-19 vaccines here in BC. We have met with Major General Fortin, VP of Logistics and Operations for the Public Health Agency of Canada, and have established a relationship with him and his team. This is an important relationship for our Immunize BC Operations Centre members. We are working closely so that we are aligned and can implement contingency plans to mitigate any challenges or disruptions. Dr. Henry has presented the phased approach to the rollout of the vaccine. As she mentioned, over the coming months, we will need to be very patient. Our approach will be slow, steady, and nimble at the beginning and will ramp up as more vaccines become available. I compare this to one of the Royal Canadian Navy ships slowly and methodically leaving Esquimalt Harbour, increasing speed and maneuverability as she heads to sea to complete her mission. Our mission includes accepting the vaccine, storage, delivery, distribution, training of staff, administration, administering, and data collection, all of which is a work in progress as we speak. Yesterday, we did a simulation exercise to prepare for rolling out the vaccine initially at the 2 locations referred to. This dry run helped us validate the plans for arrival and distribution of the vaccine and allows us to begin to iron out any of the logistical challenges before we distribute the vaccines. Our immediate focus right now is on the first phase, which will see the vaccine distributed to 2 centers in Vancouver Coastal Health and Fraser Health Authorities. 2 clinics are being set up within these centers where the doses will be administered. Health authorities will begin to canvass, they already have begun to canvass their key acute care staff, long-term care, and assisted living staff, and work with the 2 clinics to book the staff for scheduled appointments for the vaccines over the coming weeks. From this initial rollout over the next 2 weeks, we will adapt and scale up to 7 additional vaccine sites throughout the province by late January. And with the arrival of Moderna, as Dr. Henry said, we will be able to expand our ability to administer the vaccine to more British Columbians across the province. In conclusion, this has been a long journey for all of us. In one way or another, the pandemic has taken its toll on us all. While we can see the end of the COVID-19 pandemic is on the horizon, we have a lot of work ahead of us. We will be steady, deliberate, and cautious so that we get this right, so that every British Columbian can have timely access to a COVID-19 vaccine. We consider this a no-fail mission, and we're going to get it done. Thank you very much.
Thank you. And I have to say, I've been waiting for this day for a long time, and I think it's going to be even more exciting next week when we start putting vaccines into people's arms. But for today, the reason why this is so auspicious a day, because we still have COVID circulating in our province, and we had an additional 619 people who were diagnosed with COVID-19 in the last day. 4 of whom were epidemiologically linked. And that brings our total in British Columbia to 39,337 people who've been diagnosed with COVID-19. That includes 121 people in the Vancouver Coastal Health region, 384 people in the Fraser Health region, 5 people in Vancouver Island Health, 81 people in the Interior Health region, 27 people in Northern Health, and 1 new case in somebody who resides outside of Canada. That brings us today to have 9,329 active cases around the province, including 338 people who are in hospital, 75 of whom are in critical care or ICU. We now have 11,526 people under active public health monitoring and 28,448 who have recovered from COVID-19. And tragically, again, we have 16 people who have died from COVID-19 in BC in the last day, bringing our total to 559 people who have died. And this brings such intense sadness to us all. And my condolences go to those families, those care providers, and communities who have lost a loved one, again, from COVID-19. We have 1 additional healthcare outbreak at the Courtyard Terrace, and 2 more have been declared over, the Royal Ascot Centre and one of the acute care units at Burnaby Hospital. We still have 57 active outbreaks in long-term care and assisted living, and 8 in acute care, with 1,831 people affected, 1,149 residents, and 642 staff. And this is where we hope to be able to make a difference with the vaccine that is coming in these coming weeks. And until that time, we all have to do our best to remain kind and to be calm and to be safe. Thank you.
Thank you very much, Dr. Henry. And just on behalf of the Premier, on behalf, I think, everyone in BC, I want to pass on our condolences to the families, the friends, the caregivers of the 16 people who passed away in the last day from COVID-19. It is an extraordinary, difficult time, and it's a reflection on this day where there is reason to be happy, even jubilant about the news we've heard about vaccines, about the impact and how people in that circumstances are feeling every day when we get news about those who passed away. It is the hardest moment of the day, but it is nothing compared to the grief felt by the families and the communities in question. 12 of these cases were in Fraser Health, 4 in Vancouver Coastal Health, the majority in long-term care. And if possible, just to say to the families, we grieve with you. 619 cases, 9,329 active cases, 11,526 people under public health surveillance, 338 people in hospital. This is our day. We have, of course, arriving in British Columbia, some vaccine, and that's important. One of the things I want to emphasize, because all of us would look at the list presented by Dr. Henry about who will get the vaccine first and want to see where we sit on that list, and it does not reflect anything about our essential quality, but it does reflect the vulnerability of people in the population. This list, this decision, this effort is guided by science and by love. Science in making the right decisions to help people in the maximum possible way, and love, because we all, I think, are supportive of all of those people who are struggling and are most at risk, particularly those in long-term care, but in communities across BC. But I just want to emphasize on this exciting day the need to follow the orders that have been put forward by Dr. Henry, particularly those orders limiting gatherings and events in the community and at home. It has to be our own home unit together celebrating this Christmas, because physical distancing saves lives, washing our hands saves lives, staying home when you're sick saves lives. And right now, right here at this moment when we maybe see somewhere in the distance light at the end of the tunnel, is the moment we have to do that most. It is proposed that we'll have 380,000 doses of vaccine, or people to be immunized here to March 31st. That's 8% of British Columbians. There is a long road to go, but we see a positive light, and I just want to encourage everyone, because I think everyone in BC has had a part in this response to COVID-19, and I'm so proud to be a person in British Columbia on this day, so proud of our healthcare leaders, so proud of our healthcare workers, so proud of our Premier and our whole team that we are making this progress today. But we need to do it sometime longer. It's going to continue to be a challenge, and we have to keep working together. With that, I wanted to turn it back over to the Premier to take questions. And I think that, and just to remind you that tomorrow we'll be providing a regular daily briefing on COVID-19. Premier.
Thanks, Adrian. Thank you, doctors.
A reminder to those on the line, please press *1 to enter the queue. You're limited to one question and one follow-up today. Our first question is from Penny Daplos, CTV.
Hi there. Thanks very much for taking my question. Premier, I just wanted to start with you. In every other province, it's the Premier who's been the bearer of bad news that Christmas as we know it is cancelled. And I think a lot of people are just wondering why you haven't taken a bigger role in discussing complex issues like this that affect every one of your constituents.
Well, because I believe the best people to address these issues are the professionals. That's been my position going back to March, and I think the progress and success we've had in British Columbia is a direct result of me not wanting to insert myself between Dr. Henry, Minister Dix, and the public that want to hear from them about the challenges that we face collectively. I'm briefed regularly on the situations. I will be available. I am available today. I will be talking to the Prime Minister and other leaders across the country tomorrow to push the case that we need to focus on the end of this pandemic. And we do that by not taking limelights, by not being there for the good news and the bad news, but being there when I'm required. And that's been the approach we've taken. And to not a great deal of criticism. I certainly am open to any criticism you want to level at me, or British Columbians want to level at me. But the vast majority of the people I engage with tell me how confident they are that our public health is being driven by Dr. Henry, and Minister Dix has been at his post daily for the whole day and much into the evening, making sure that British Columbians are safe.
Penny, do you have a follow-up?
I do. Thank you, Premier, for that. I wanted to go to Dr. Henry next. We are seeing some success with the restrictions that you have brought in and now extended. The curve seems to slowly be bending. And however, it does seem that it's come too late for us to have Christmas with our families as British Columbians. And I'm just wondering, do you regret not taking those steps and enhancing those restrictions a little bit earlier?
Yeah, you know what? I still don't feel that we're at a place when we can start second guessing what we did when we did. We followed the plan that we had put in place, and we took action as soon as we started to see rapid increase. We have seen a flattening, but we're also learning about this virus, and we're not alone. We're learning around the world, and we're learning that the things that worked in October and September didn't work when we reached a certain level of cases and when the virus was able to transmit so much more easily at this time of year. So we put in the measures, the additional measures that we needed to take at that time. And yes, we have not, well, I think we've not bent our curve, but we've flattened it so that we're at a point where we're in a fine control. But we really need to keep these measures up to get that down. We are seeing our health care system strained. We are still seeing far too many people in long-term care being infected and sadly dying. And that is a reflection of the transmission that we're seeing in our communities. So we all still have work to do to protect those who we care about most, whether it's in our family, the people that we're closest to, and our seniors and elders in particular.
Next question is from Richard Zisman, Global.
Dr. Henry, when the H1N1 vaccine was distributed, there were a lot of concerns about queue jumpers, those trying to get access to the vaccine earlier. Can you explain how the province will prevent those from jumping the queue and maintaining this order? And is there any sense yet on when, public health officials like yourself may be able to get access to the vaccine?
Yeah. So I think people like myself, we will be ready to take it if whenever it's available for other healthcare professionals. So I will be first in line if that's needed. If there's problems, people are worried that the vaccine has challenges. I know there's some people that are concerned that this is a new vaccine, and I am confident from the data I've seen and from the review that Health Canada has done that it is safe and that it works. But we will do whatever we can to communicate with people, make sure they have the information they need to safely step up for the vaccine. Yes, we always are concerned that some people feel they're more at risk and want to be included at the head of the line. We are taking a very thoughtful approach to how we use the scarce resources that we have at the beginning. But I will reassure people that we absolutely expect to have a lot of vaccine coming online after the first few months of 2021, and it will be available in many different places for everyone. And we will be working, as we've been working on all the ideas already, of how do we make it a system that's fair for people to get access, so that because you live in one part of the province or the other, or you don't have access to the internet, you're not put at a disadvantage. So those are the things that we are still working out the details of, and we have the luxury, I guess, of a little bit of time to try and work out some of those details as we're focusing on the very key people who need this vaccine most for their own protection.
Richard, do you have a follow-up?
You mentioned those key people that need the vaccine. With the Pfizer vaccine, when do we actually expect those in long-term care to be able to access it? Like, is there any timeline yet on when the vaccine will be able to move into those homes? And just to my last question quickly, I don't really know, are you going to stop, people just will not be able to get the vaccine until it's their turn?
Well, there's different ways of doing that. So it is accessed by where the vaccine is available. So whether it's a public health clinic or whether a pharmacy or a physician, and then how do you get into the queue to that public health clinic or that pharmacy or that clinician? So we're working on those details. One of the simplest ways to look at that is doing it by age. And that is one of the things that we across the country are looking at, with understanding that the older you are, it's the single most important risk factor for having severe illness or succumbing to COVID-19. Oh, shoot. And I know you asked me another question that I got distracted on.
Long-term care, people living in long-term care.
People living in long-term care. So I can tell you that it is changing. It's changed 3 times today already in the information that we're getting back and forth from Pfizer about handling of the vaccine. We expect that it will be able to be broken down and transported in limited ways, perhaps in the next couple of weeks, but we believe at least by the first week of January. We are also putting into the mix the fact that we believe that the Moderna vaccine will be available very soon as well, and it is more flexible in transportation. So if it becomes available sooner, then we will focus on using that vaccine to get to residents in long-term care so that we can do it without wasting any vaccine at all.
Our next question is from Justine Hunter, Globe and Mail.
Hi, thank you. Dr. Henry, it sounds like getting Moderna is going to be very critical to vaccinating seniors in care homes. I'm just wondering, I know you say soon, but do you have an idea of the timeline with that?
These are things that Health Canada keeps their cards close to their chest because they are the ones that need to make sure that all of the safety and quality bars are met. We do know that they have received all of the data that they need and that they're reviewing it. So, the signals are that it will be soon. But I will say we do have plans for using the Pfizer vaccine and being able to take it to care homes, particularly in the urban areas. But yes, having more flexibility in transport is something that would be very helpful, not only for care homes, but also for more remote communities that are smaller communities. And across the country, for example, we've allocated to the territories the Moderna vaccine because they don't have the infrastructure to be able to handle the large doses that come frozen with the ultra low temperature Pfizer vaccine. So those are considerations that we have as well for some areas of the province.
Justine, do you have a follow-up?
I do, thanks. And this is for Premier Horgan. I'm just wondering if you can talk a bit about the negotiations you've been involved with Ottawa in terms of distribution. I know, for example, Manitoba is getting extra doses of Moderna because of their Indigenous population. I'm wondering, does BC argue that we should have a larger allotment of that because we have such a large, significant elderly population?
And a significant Indigenous population as well, in not just in urban populations, but in rural BC as well. I spoke with Brian Pallister today, the Premier of Manitoba. We have been in regular contact, of course, over the past 10 months with respect to COVID, but also on the Canada Health transfer, which is an issue that both of us are pretty passionate about and feel that the time is right at the middle of the second wave of a global pandemic for us to talk about the future of delivering healthcare services in British Columbia and in Manitoba and indeed across the country. And so in terms of the discussions tomorrow, Dr. Henry and Dr. Tam, her counterpart in Ottawa, are in regular contact, as are officials in my office and the Prime Minister's office. We've been making the case aggressively, as we do on all matters, that British Columbia has unique populations, unique challenges, and we'll continue to make that case tomorrow in the First Minister's meeting, and I'm optimistic that our arguments will win the day, and we will be treated in terms of Indigenous populations as every other province in the country. And in terms of an aging population, particularly on Vancouver Island, where case counts are quite low, and receptivity to vaccinations, but based on polling information, is extremely high. So we have a bunch of positives for us in British Columbia that would put us, as I would suggest, certainly on an equal footing with every other province in the country, and perhaps getting a little bit of a nudge because of an aging population.
Our next question is from Marcella Bernardo, News 1130.
Hi there. My first question is actually for the Premier. If you could maybe just give us some insight into what advice you have for people who've already booked hotel rooms and flights for the holidays and now are telling us that they can't get a refund. I guess what hope can you offer them that they should still be staying home and not traveling?
Well, we've been taking counsel from Dr. Henry and her team for months now. Dr. Henry provides advice to the minister brings it to cabinet, and the government makes decisions. Obviously, there's autonomy for public health orders that Dr. Henry has. For those who have been made reservations and are running into obstacles with the provider of their room or whatever it might be, certainly we are looking closely at these issues. I would suggest that making decisions about where to travel in the most extraordinary of years, I think what would have had a little bit more foresight would have perhaps anticipated where we would be right now. Having said that, I certainly have sympathy for those who put money out to find a place to celebrate the end of this year and the holiday season that we're in. We have a plan for the tourism sector that we received a report today from a task force that was created by the sector, chaired by Tamara Vrooman, the CEO of the Airport Authority in Vancouver. A lot of positive recommendations. We'll be seeing money flowing to the tourism sector, which I hope will allow them to provide refunds to people who will not be able to get the services that they paid for.
Do you have a follow-up, Marcella?
Yes, this one is for Dr. Henry or Dr. Ross, whoever is comfortable answering this. But will these vaccines still work if the virus mutates, like studies have indicated it has in other parts of the world? And is it adaptable? Is there research showing that that's possible?
Yeah, so we have been watching very closely about mutations, and this virus does mutate, but very slowly. So the vaccines, all of the vaccines are really targeted towards what we call a conserved area of the virus, the spike protein. So that was a concern with the mink farm in Copenhagen, where there was a mutation, a variant that had a slight change in that part of the virus genome, the virus RNA. So as you are probably aware, they culled all the mink in that area. We have, as you know, a mink farm outbreak here in British Columbia, and that is something that we are watching very carefully. We are doing what we call whole genome sequencing on the sequences both from the mink that have been tested positive, but also on the humans to see if there's been any change in the virus that might have any effect on the spike protein and therefore potentially have effect on the vaccine. But the studies that have been done of both Moderna and the Pfizer vaccine, the AstraZeneca vaccine, the Johnson & Johnson vaccine, all of which have been in different parts of the world where the virus is still circulating a lot. And up until very recently, the studies were just completed in the last month. So it has shown that there is very good effectiveness from the vaccines that we have right now. So that's reassuring, and we'll be following that really closely.
Next question is from Les Lane, Times Colonist.
Oh, thanks. When do British Columbians get to put their masks away? There's a lot of reports that you have to wear a mask even after being vaccinated, and the uncertainty over whether masks prevent transmission, asymptomatic, I guess. What's your take on that?
What's my take on that? You know what? We are subjected to a few things for the next little while. It's the people that are most at risk of severe illness that we're starting with, as I mentioned. But once we start having enough vaccine in the community to immunize people in a wide scale, and it probably takes about 60 to 70% of the population with this virus, that's what the modeling tells us, of people to be protected. And then the virus has a very hard time finding a new person to infect that isn't already protected. And once we get to that point, that's what we call, I like to say, community immunity. The technical term in the epidemiology world is herd immunity. And when we reach that place, that is when transmission can be stopped. And my experience with past pandemics is once we reach that place, transmission goes down very rapidly. For those who remember an H1N1 in 2009, by the time immunization started, we had a dramatic decrease in our epidemiologic curve. And I am hopeful that that will happen once we reach a certain threshold with this virus. In terms of timing, that means we're looking at the summer into the fall of next year, in my best guess. And obviously I don't know all the details and how it's going to work. But if everything goes as planned, that's what we're looking at. So I think we're going to have a very different and much more social summer. And I think into next fall, we'll get back to some semblance of our normal ways of interacting with each other, be able to see each other again safely. And the pandemic, I hope, will be on its last legs. So yes, we probably won't need to wear masks anymore. We won't need to keep those distances. We will still, of course, need to stay home and stay away from others when we're not feeling well, and always wash our hands.
Do you have a follow-up, Les?
I'm just wondering about the prioritizing. When you forecast 380,000 priority people being vaccinated by the end of March, are you counting them as they've taken the double hit? You have to get 2 shots, so 2 or 3 weeks apart. Is that count them fully vaccinated, or is that just the first one?
Yeah, so that is a combination, because we know how much vaccine we're expecting to get in that period of time, but we also know that there's more vaccine coming after that, so it doesn't account for, and I said the minimum interval between the first and second dose is 3 weeks, but we can extend that interval. We know that there's very good protection about 14 days after the first dose, so that's why it's important to take precautions after somebody's been immunized, because they don't reach that full protection for some time. So we can possibly, depending on how things go and how much vaccine we get, we may delay the second dose for some people. But those are all things that are still up in the air. But the calculations of number of people who receive the full course of vaccine by that end of March is about 380, and some of those people will not be due for their second dose until into April and May.
Our next question is from Rob Brown, Dawson Creek Mirror.
Good afternoon. The question really looking ahead past this 400,000 first initial wave into the summer is I guess my question would be either Ross or Dr. Henry, tell me, how do you expect to get to that 70 or 80% of people vaccinated, where as of right now there seems to be anywhere from 25 to 40% that seems to think that this is about a reset, that vaccinations may not be good or good in any way. There's the tinfoil people, of course, and then there's others that are just flat out refusing to look at the science low the last 10 months. How do you get to that, in British Columbia, let alone Canada, to that 70 to 80% almost herd immunity type situation as far as the math?
I think it's a little bit of, there are a very small number of loud voices that we hear a lot of, but when we do polls and research, and a study that was done by colleagues at BC CDC and the Women's Health Research Centre, our Vaccine Evaluation Centre at Children's here in BC, that just finished last week, it showed that 86% of people in BC are looking and intend to receive vaccine. It varies by different parts of the province, but that tells us that people are recognizing that this is important. And that's different than what we see in the United States, for example, where the attention to the science behind what is going on may be different from what we see here in Canada. So I am confident, particularly healthcare workers who recognize how severe this virus has been affecting themselves and their colleagues, but also seeing people who have ended up in hospital on ventilators, or the people they care for in long-term care who have passed away from this virus. So I know that there's a lot of people out there who are ready and willing to get this vaccine, and we know, and I'm confident, that it is a safe and effective vaccine. So I believe we will get there very quickly.
Do you have a follow-up?
I absolutely do. It's actually for the Premier. Not to accuse him of, or being accused of queue jumping or anything, but from a PR point of view, is there a chance that you yourself would take, get the vaccine early, or, bring out Ryan Reynolds or Seth Rogen to get the jab as well?
Well, I think Ryan and Seth are in a demographic that wouldn't require it. But I'm certainly, as with Dr. Henry, I'm certainly prepared if it's in the interest of giving the public comfort about the safety of the vaccine. I'm happy to take one. My youngest son advised me over the weekend that I was probably old enough to get into the line. I didn't appreciate that very much, but it's a reality. I'm prepared to do whatever is in the best interest of advancing the cause of getting as many people immunized as possible. I hope that answers your question. I do not want to queue jump. I do not want to elbow people out of the way to be at a microphone or to be in a photo op. I want to make sure that British Columbians get the health care that they need. And with leadership from Dr. Brown and Dr. Henry, I'm confident that we're on the right track.
Our next question is from Gord Hoekstra, Vancouver Sun.
Thanks for taking my question. I'm just wondering if you can give any more details of the actual locations of the clinics where the first vaccines will be dispensed.
I will tell you that they are in healthcare facilities that are in the Vancouver Coastal region and the Fraser Health region, and we're not saying more than that at this point. We know that this is a really important thing. We also know that we need to take all the precautions that we can to make sure that we can handle the vaccine, and the packaging safely, so that we're able to carry out the clinics in a safe way, and that people are receive all of the attention that they need. And we don't want to be doing that under the glare of media at this point. We also know that because we need to keep it in these ultra low temperature freezers in a healthcare facility, that we don't have the ability for a lot of people to come around. And quite frankly, we have credible information from sources nationally and internationally that there is people who are targeting vaccines. So we are going to be a little bit circumspect early on, and make sure that we're able to best protect the precious vaccine that we have and be able to safely administer it to people.
Do you have a follow-up, Gord?
I do. I'm just wondering, you mentioned that there'll be 7 more sites by, I think, the end of January or sort of late January, and then you expect to have, 30 at some point. Can you tell a little bit about how those will roll out? Will they be restricted initially to the lower mainland, or will it immediately try and add, sites, in, whether it's Vancouver Island or the interior or the north?
Yeah, so the plan is to start where the need is most and where the most people are. But yes, we have plans within by the early or middle of January to make sure that we have sites, and they have been identified in all regions of the province. So we're learning from the first trial run that went this week, and we'll learn more from the trial run, or the initial vaccine distribution and clinics next week. And those learnings will be shared around the province, but we do expect within the coming weeks, by January at the latest, that we will also have vaccine available in every area of the province.
We only have time for one more question today. That's going to be from Eva Eugen from Radio Canada.
Hi there. I was wondering, for the first 4,000 doses, what are the logistics behind administering those, the 2 doses? Do we have enough vaccine for 3,900 people to get both, or are you planning on staggering that so you can really prioritize getting those long-term care workers fully immunized as soon as possible? And could we also get an answer in French?
Yes, so there's the 2-dose series has to be given at least 21 days apart. So we will be giving, the 3,900 and some doses to individuals next week, and then they will get their second dose at least 3 weeks later, with more vaccine that comes at that time. So we aren't holding back doses because we want to protect as many people as possible as quickly as possible. So there is a minimum time that you can't give it. Your body doesn't recognize it as a second dose if you give it too soon. So it is important that we give the first dose, and then we wait 3 weeks before the second dose.
Oui, effectivement, on va avoir plus de vaccins, 2 semaines à une autre semaine. Donc, on commence la semaine prochaine avec 4,000 doses, et puis on va jusqu'à plus que ça chaque semaine, j'imagine. Donc, ce serait tout à fait possible de faire une horaire pour la province avec un taux montant de vaccination. Il y a une attente de 3 semaines minimum entre doses. Donc, il est évident et important et possible de défendre nos centres de soins dans la province d'une manière efficace dans les semaines à venir. Donc, c'est simple, en fait, on va avoir de plus en plus, et donc ce serait facile pour les gens qui reçoivent leur vaccination la semaine prochaine d'en avoir un autre dans plusieurs semaines.
Do you have a follow-up, Eva?
Yes, I wanted to know, how are you identifying people from the vulnerable category for being prioritized for vaccination, such as seniors or other people with pre-existing conditions? Is there a registration process that will allow them to self-identify?
Yeah, so one of the reasons we are starting with healthcare workers and people in long-term care, other than the risk that they have, is because we can identify them quite readily. And actually, because of the order that we put in earlier this year around single site, it means we have identified everybody who works in every facility. So that's very helpful, actually, in determining who goes first. We've also done a process that's been done at each of the health authorities to prioritize the highest risk facilities, so ones that have the largest numbers of people, more people in double rooms or triple rooms and things like that. So that's how we are doing it for the first piece. We are working on ways of identifying people who are community dwelling seniors. We are looking at things like registration with MSP, where we can tell people by age cutoff, and we will be developing a system that makes it fair for people to get access to vaccine once we have those cutoffs in place, once we have more vaccine available. So that is something that is still under development right now.
Thank you, everyone. Oh, go ahead, Mr. Nick.
Oui, et effectivement, c'est une des raisons qu'on a décidé de commencer avec les résidents des centres de soins à long terme dans la province. Et pour cette raison-là, c'est simple, et surtout pour les travailleurs, les professionnels qui travaillent dans ce domaine-là. C'est important pour raison de santé, mais aussi ça rend efficace nos efforts dans les 2-3 semaines à venir. Finalement, je veux dire en français ce que le Premier ministre a dit, Horgan a dit il y a quelques minutes. Il est essentiel dans notre pays que le gouvernement fédéral participe pleinement à notre système de santé dans le pays, c'est-à-dire d'augmenter leur partage, leur montant au Canada Health Transfer actuellement. Il est essentiel pour cela parce que si cette pandémie montre une chose, c'est la centralité de notre système de santé. Et maintenant, il faut agir. Il est temps d'agir. On n'a pas vraiment agi depuis 2004 et c'est le moment d'agir. Merci beaucoup. Thank you very much.
Thanks, everyone.
And we'll see you soon. See you tomorrow.
Thanks, man.